PEP Talk is a series of prevention education programming designed to build skills in children and youth that contribute to the development of healthy relationships and the prevention of abuse and violence, including gender-based violence. This Public Health Agency of Canada project is a partnership with the Factor-Inwentash Faculty of Social Work at the University of Toronto to conduct a formal program evaluation on the PEP Talk Intermediate Program.
Before we actually begin working with students, we usually meet with faculty and administration to let them know who we are, what we're about, what we're going to be talking to students about. And many of those faculty members and administration members told us how exhausted students were, that they may not be very talkative if we were online. And so we really had to find a way to engage those students to participate a lot more. What was surprising for me were the kids were very eager to have these discussions. They were willing to not only answer the questions that we discussed, but also ask their own. And it was kind of refreshing to see that teachers were also getting involved in the conversation as well. Many of them would give me feedback afterwards saying, these are conversations that are so important to have, but I don't know how to initiate it. And we're really glad that you guys are here to help us with that.
Just really excited to say that we saw some significant changes in areas that we were hoping to find, starting with the sexual consent scale. And we definitely saw a significant increase in how students viewed consent and broadening that definition. So they had an increased awareness of harmful sexual consent norms and an increased self-efficacy and confidence in asking for consent, and increase in positive attitudes to establishing consent. So this is huge. We also had developed an acceptance of dating violence scale. We wanted to see if we could see significant changes in how they viewed perhaps traditional gender stereotyping so that students were more open and more accepting of healthier ways of conducting themselves in dating situations. And then we saw some of those differences between the control group and the intervention group. And again, we saw that those students who took the PEP Talk program having an increase in their awareness of sexual consent, how to be more confident about asking, establishing. And we also saw that the intervention group showed an increase in awareness of dating violence prevalence and how to identify that. So we were just thrilled to see these changes, knowing that the program had established effectiveness in what they had set out to do. I wanted to say just how valuable it was to be a member of the communities of practice, especially given that just after we had started delivering the program and evaluating it, we got hit by the pandemic. And we had to really develop innovative, unique ways of continuing to deliver the program and to do the evaluation online. And so it was through meeting with the communities of practice, the different teams, the different project leaders and participants that we were able to share ideas, problem solve, so that we were able to continue those aspects of both program service delivery and evaluation of it. It's what kept us going.
I am very grateful to PHAC and PREVNet and the community of practice for allowing us access to what other people are doing in similar programs across the country. And I found it very valuable to share resources. We're able to learn from other people's experiences. We can share curriculums, sharing resources and literature reviews and background information. It's very useful and very efficient and really validating to share work that you're doing with other people who are doing similar work across the country. I found it extremely useful.
I have the privilege of being able to go into schools and speak to students about some of these very important topics. I also have a very unique advantage that I get to see the development, hear the growth, see the learning, experience that with the students. And it may not be apparent to the people who are involved in PHAC funding, but everything that we were able to do was because of them. And so I think it was a really great partnership.